What's up, everybody? It's your girl Tanya, back at it again with yet another video. If this is your first time watching, welcome. My name is Tanya and I am a single mommy in nursing school. I'm just about getting ready to finish and I am doing an internship in an ICU floor. And in this video, I'm going to give you guys an update on my experience in the ICU so far. Okay guys, so I know that it's been a minute since I have updated you guys. I think the last video that I made was telling you guys how I got an internship in the ICU or a nurse apprentice position, whatever you want to call it. But it's basically like a paid position in the ICU where I am working as a nurse pretty much. I mean, I'm still a student, but I'm basically doing everything that the nurse is doing. I don't have my own patients, but I am doing a lot of the work. And I'm just gonna tell you guys like my experience so far and like what I think of it. And it's actually very different from what I thought it was gonna be. Like very, very different. And there's good and there's bad. I don't even know where to start, to be honest. I wanted to film this video like during the weekend because I've been working weekends like Saturday, Sunday, Monday nights. And I kind of wanted to film it like right after I had got off because everything was fresh on my mind. But to be honest, like when I get off like 7:30 in the morning or 8 in the morning, I am like dead, dead. And my mind is just kind of like fried and I can't even really process things. I just thought, okay, I'll just film it on my day off when my mind is like a normal person's mind. So today's my day off. Okay, so let me get started. So things that I didn't expect working in the ICU, I didn't expect all of like the physical labor that comes with being a nurse in the ICU. Like, I don't know, like I've never been a CNA before, so I don't know, like I don't want to sound like a princess, but I didn't realize like I was gonna do so much, like a lot of turning the patients, cleaning the patients. I would say 90% of those patients in the ICU are intubated, which means they have, you know, a tube down their throat connected to a ventilator, which means they don't talk to you, which means that they aren't breathing on their own, they're not eating on their own. They basically need all of the assistance, you know, possible. So you're feeding them through like TPN, you're changing them. Some of them have Foley's. Just tubes everywhere. Like there's tubes everywhere. There's tubes in their mouth, there's tubes in their stomach, there's tubes, peripheral lines, there's PICC lines, there's central lines, there's all sorts of lines. Like there's tubes coming out of everywhere in the body. And I think I was very like new to that because I mean I've been in the medical field, but I've worked outpatient, meaning like primary care office, urgent care, things like that. So I've never worked inpatient like that. So working inpatient in a critical care setting is like a whole nother world. And at first it can be intimidating just because they're very, very sick. And I just don't want to do anything wrong, like to hurt them, you know. And I remember the first time I did a bed bath, the nurse was like, oh yeah, just be careful with their chest tube because, you know, you don't want to pull that out. That's gonna like collapse their lung and possibly kill them. So I'm just like, oh shit, like I'm not trying to kill this patient just by trying to turn them, you know, like they're just so sensitive. You just have to be careful with all of the tubes. There's a tube for everything. Like if there's not a hole, they will make a hole for something. So I'm not gonna lie, the least thing that I like is doing bed baths. Like when I first started, I was like, oh my God, like, oh, I have to like do all of this hard physical work, like turning them, cleaning them. There's like so much different like bodily fluid coming from everywhere. They vomit, they like poop everywhere, they piss everywhere. They're like babies. The patients in the ICU are like babies. They can't do anything for themselves. And to be honest, it is really hard to see people like that in that state. That's the hardest place to be in, is in the ICU. Like nobody wants to be that sick, you know, especially like if you have a loved one that is like that. It's really sad. So that's another thing that is kind of like uncomfortable for me. Well, not really, but kind of, is seeing people that sick, you know. But to be honest, after like the third or fourth shift, I kind of got used to it. The first shift, I was like, oh my God, like this is crazy. The second shift, I was like, wow, this is really hard. The third shift, I was like, all right, well, I'm just kind of used to this already. Like, and I've been there, I think, almost a month. So now I'm just like used to seeing that, all the things. Like, I'm kind of getting used to the environment. What I do like about working there is that I'm learning so much, like so much. I think every time I go to work, I'm just like, I learn something new, or things are coming together, things are clicking for me. Because when you're in school, like, you learn things, but it doesn't really click until like you're in practice and you're seeing stuff and you're putting things together. Or when you're giving medications and you're like, okay, why am I giving this medication? What is this doing for the patient? And you start asking yourself like these critical questions, and it starts to make sense when you're in the field versus like when you're just like learning from a book. So I do really like that I'm learning a lot, like a lot. And do I like critical care? I don't know. I'm still debating. I'm literally still debating it. I really do like parts of it. Like, I like how critical care is so like deep. Like, you have to know a lot. You have to know your shit. Like, you have to be really good, because this is people's lives, literally their lives in your hands. Like, if you make a mistake, you could possibly hurt someone, kill someone. Like, it's scary, like, even just to say that, but that's why you have to be really good at your job, and you have to be very good at anticipating things. That's what I've noticed, that the ICU nurses, they're very good at anticipating what the patient's gonna need, what orders the doctor's gonna put in. And I like that in the ICU, the nurses do have a lot of autonomy, I would say, because especially the one that I'm in, there's not a physician at night. There's a PA or an MP at night, and the nurses make a lot of decisions on their own. Obviously there's parameters and stuff, but they're just very good at like critical thinking. Like, they're very good at it, and I hope that one day I can be that good. But it is intimidating. ICU is just intimidating, but I like it because it's challenging. Like, it's really challenging me to think. And for those of you asking about like I think somebody asked me about the nurse apprentice, like what they do. So basically I'm able to do like a lot of things. I'm able to do pretty much everything except for maybe push. Actually, I can push medications. I've been pushing medications, but I'm able to do everything as a nurse. It's just I have to have supervision from an RN that has a license, obviously. So I don't have a license yet, so I can't like do things on my own. But the nurses where I work are very good at letting me do things on my own. I obviously don't have my own patients, but I usually will follow a nurse, like I'll shadow a nurse, or I'll be like a task nurse, which means like I basically run around and do, you know, tasks for different people. I help a lot with bed baths, a lot. Like, I should be like the bed bath queen by now. I do a lot of that, and at first, like I said, I didn't like it, but I'm actually like getting the hang of it. It's a technique. Doing a lot. I'm learning a lot. I'm doing a lot, and I'm actually feeling very comfortable on my unit. So I'm hoping I could transition into a new grad there. But to be honest, I don't even know at this point, because I'm kind of like in a point where I'm weighing out different things, like if I like critical care or if I want to do something else. Nursing, like, there's so much that you could do. There's so many opportunities. You could change fields, like you change specialties as much as you want. And I don't know, I'm still kind of debating if I want to do critical care right out of school or if I want to try something else. But I will let you guys know, obviously, because I'm going into my last semester, so I do have to make up my mind pretty soon. I am going to be applying for new grad positions pretty soon, and I need to like figure out what the hell I like. But so far I like critical care. I just don't know. There's a lot of things that are very scary about it. It's very challenging, and you know what? It's very challenging, not just physically, but mentally. It's like mentally exhausting. Tuesday morning, I saw a patient pass away, you know, in the ICU, and that's the first time I've seen that since I've been working there. I knew I was gonna see it because people die in the ICU all the time, but that was the first time for me, and it was a very eye-opening experience. I mean, I've seen people die before in regular life, but I've never seen someone die in a setting like that, and also being like someone taking care of that person. I just never been in that position, so it was it was a first for me, and I don't even really know how to explain how I felt. I didn't really feel emotional like I thought I was gonna feel. I kind of just was like trying to learn from it as much as possible. I don't want to give you guys details about like the patient and stuff because I don't feel comfortable doing that on the internet. So I'm not gonna even tell you guys like how this patient died or any details about it. Just know that the patient died and I was right there at the bedside. I did help extubate her. Which means like she was intubated, so they took the tube out and disconnected from the ventilator. I helped do that, and I, gave the patient oxygen for comfort while she was leaving us, and it was an experience, and I didn't really know how to feel at the moment. I didn't process my feelings until I drove home. And I talked to my mom about it, and I talked to my sister about it. And I think that being an ICU nurse, you have to really know how to be on your toes and be professional during work and not let things like that get to you. You have to be empathetic, but you also have to be like strong and, disconnect, because, you still have to take care of another person that has the possibility to live. So yeah, it's definitely an emotional toll, and that's one of the reasons why I'm still debating if I want to go into ICU or critical care right away, because it is a lot like to deal with. Like you have to really know how to manage your emotions, and I think I'm getting a lot better at that, a lot better than how I used to be in the past. So yeah, I'm leaning towards critical care. I really am. I'm liking it so far. I still have a few more months left of this internship, so hopefully by the end of the internship I'll know for sure if I want to do it. But it's definitely a great learning experience. I think I'm gonna gain so much, like by the time I'm done with nursing school and by the time I'm done with this internship. I feel like I'm gonna be feeling very confident to take care of sick patients. That's pretty much my update. I'm sorry that I haven't really been active per usual. I say that all the time. I'm so bad at being active, but hopefully I can make more content for you guys. If you guys have any questions about this internship that I'm doing, if you have any questions about my nursing school program, I know everyone's interested in that. If you just want to say hi to me, just say hi to me, just send me a message. I love getting messages from you guys, and I'm gonna try to make more videos coming up soon. If you guys can just let me know what kind of videos you want to see, that would be great, so that way I can create stuff that you guys like to see. And again, thank you guys so much for watching. You guys are amazing. I love you guys with all of my heart, and God bless you. Mwah, mwah, mwah.